Hi, this is Dr. Centeno, and today I'm going to go through pain in the front of the hip. What's wrong? So if you have pain in the front of the hip, what I'm going to do here is I'm going to strip back layer by layer what's there so you can see what might be damaged or hurt that's causing this pain. So starting at the skin level, the first thing that you should look at is the L2 spinal nerve. This stripes through this area. And what that means is this is a nerve that comes from your back and goes right here to the front of the hip. So that means that a problem in your back can make you feel hip pain. So the next layer down shows us the ASIS, which is right here. And that's where a lot of muscles, including some of the quadriceps muscles, come from. Now, if we go even deeper, what we'll see is the iliopsoas. And the psoas is a muscle that connects the spine and the hip. And then you have the iliacus, and together they're known as the iliopsoas. Then you have the adductor muscles down here. In addition, notice that you have an iliopsoas bursa, which is this in red there, and then a whole bunch of ligaments around the hip. You also have the hip joint itself, and then the labrum, which is the lip around the hip joint. And then you have the SI joint, which I've marked in yellow here, which can also refer pain to the front of the hip. So how do you tell if you have one of these? Well, if it's the L2 spinal nerve, the skin over this area will feel different than the other side, and you should test, touch, pinprick, and hot and cold. If it's the quadriceps muscles, then that ASIS area there shown to the left at the red circle will be tender, and there'll also be tenderness in that quadriceps muscle. If it's the iliopsoas or adductor, you should be able to put pressure right over the hip joint itself or just inside of that area, and that will feel very tender. So if it's hip joint arthritis or a tear in the labrum, oftentimes you'll have decreased range of motion or clicking with pain when you walk, etc. Now, testing the range of motion is easy. Just look at how much that hip is able to move on things like putting on your socks, etc., versus the other side. If it's the SI joint, in addition to having pain in the front, you'll often have pain in the back here at this PSIS area shown in red. So to find out more about these problems and how to fix them without surgery using advanced regenerative medicine, see regenetics.com, and I hope this video helps you figure out what's causing your problem.